So now let's get to the topic at hand, and that is how to prevent your blood pressure from going up and how to bring it down if it's elevated. So I'm not going to ask you, but if you're on high blood pressure medicine, maybe you could just hit the love button, okay? And just so I know that, and I don't even have to ask. I know there are a lot of people out there that are on blood pressure medicine. Hey, Lisa, thank you for joining me. Thank you, Sarah Lynn, for joining me and for commenting. Yeah, that's good. That's how people get to see more of this. So this is life-changing information. Well, first of all, I want to tell you, I'm not a medical doctor. I have a doctorate in physical therapy from Boston University, but I've done a lot of research on health and wellness, and I'm a health coach, and I've helped over probably now about 750 people lose 30 or more pounds. But more than that, I've helped them learn how to get healthy and help their body. And so one of the first things that happen when people get into my challenge is, if they're on blood pressure medicine, is they notice that their blood pressure drops. And I'm about to explain to you why that happens just with the nutrition program, okay? Now, you may have thought that salt and fat is what made your blood pressure go up. Well, I'm here to tell you that is not the case. Salt is not the issue. It is sugar and toxins and unhealthy fats. So polyunsaturated fats. So the fats that you find in this, vegetable oil, canola oil, sunflower oil, soy oil, so many of the toxic oils. So you want to get those out of your house. You never want to use those again. So let me just talk a minute about, okay, so, and so what I'm offering here is not medical advice. It's really just what I've seen with my clients. So I'm not telling you to come off of your medicine. Absolutely not. If you have high blood pressure, then you take what your doctor has told you. What I'm going to tell you is how you can lower your blood pressure, okay? And if your blood pressure lowers, then you can come off your medicine. That makes total sense, doesn't it? Okay, but I'm also going to tell you how to prevent high blood pressure, okay? So high blood pressure is epidemic right now, and it's very important that you know this. And the reason it's so important is because, hey Karen, hey Catherine, the reason it's so important because high blood pressure is responsible for strokes, it's responsible for heart attacks, it's responsible for peripheral vascular disease, for atherosclerosis, for blindness, and other things, okay? So we definitely need to get our blood pressure down, all right? So, and it also will cause end organ disease. So you definitely want to do that. And but you can lower it. You can lower your blood pressure without medication. And how do I know that? Because I have seen client after client after client. In about the third week of the program, they start to notice they're feeling a little slump. And normally they've been feeling better, but all of a sudden a little slump. And what's happened is they're still on their blood pressure medicine, but their blood pressure is dropping because they're reversing their insulin resistance, and they're getting the toxins out of their body and the sugar out of their body. They're getting off of sugar, and their blood pressure's dropping. So I tell them immediately, I said, check your blood pressure. And they're like, yeah, my blood pressure's lower than it ever has been. I'm like, yep. So call your doctor and go see him, and they'll probably cut your blood pressure medicine in half. And that has happened. I can just sit here and I can just name people right now that that's happened to. So you can come off your blood pressure medicine. All right, so here's one thing you need to know that you probably have never heard before. I had not heard it until a while back, but once I started studying, I got the right information. And I got this information from cardiologists. These are doctors that work on the heart. They do stents, they do, open heart surgery and all those things. So what they know, and I know, and now you know, is that fat and salt is not the culprit. It is not the culprit. And I'm about to tell you what causes high blood pressure. So the number one cause, the main cause of high blood pressure, or the cause of high blood pressure, is metabolic syndrome. Now, how many of you have ever heard of metabolic syndrome? Type in the comments, yes, you've heard of it, okay? Or no, you haven't, all right? So what metabolic syndrome is is, other than being the cause of high blood pressure, is it is a cluster of issues, of symptoms. Okay, so high blood pressure is really a symptom of other diseases. All right, so one of the symptoms of metabolic syndrome is high blood pressure, but it's also decreased HDL. Okay, that's one of your cholesterols, and increased triglycerides. So I've already named you three: high blood pressure, low HDL, and high triglycerides. The other thing is, if your BMI, that's your body mass index, is over 25, then you have metabolic syndrome. And if you are insulin resistant, you have metabolic syndrome. Now, I'm going to tell you a real quick way to know if you're insulin resistant is to stand with your feet together about shoulder width apart, look down, and if you can't see your toes, then you're insulin resistant. Because what that means, if you've got fat around the middle and you can't see your toes, that's just one test. Now, there are other tests, of course, to test that, the HOMA test, and checking your blood sugar and all that. But that's the main one. So 50% of the population is obese. 80% of those obese people have metabolic syndrome. All right, those things I just mentioned. 20% of the people that have metabolic syndrome are not overweight. We call those TOFIs. So thin on the outside and fat on the inside. And those people are going to be insulin resistant just because you're thin doesn't mean that you're healthy. You're going to be needing to get, if you have high blood pressure, you're going to be needing to get your triglycerides checked, your cholesterol checked, all those things checked, and you too can lower your blood pressure. So the one factor in metabolic syndrome that causes it is increased insulin. So it's a hormonal problem, all right? And so what causes increased insulin is too much sugar, too many carbs, complex carbohydrates that people are taking into their body over a long period of time. And what happens is your pancreas just creates more and more and more insulin to deal with the carbs that you've taken in. And I'm just going to say sugars, but carbs, all right? That's your bread, your grains, your high fructose corn syrup, sucralose, maltodextrin, everything. The food industry is putting so much sugar in things now, all right? And so it's in everything. It's in cereals. It's in these healthy protein bars. I mean, I even got some keto cookies in the mail today. I was just going to try them, and they had 13 grams of carbs. That's almost as much as you need in a whole day in 2 little cookies. They were little cookies, okay? So how does insulin... So metabolic syndrome is caused by insulin, increase in insulin. Well, you think, well, insulin's supposed to be a good thing. That's what they give diabetics to lower their sugar. Well, yes, they do. That's what insulin's created for. But too much insulin is not good. And you notice that if you're on insulin or metformin or one of those derivatives, you're going to have to keep adding to that. Every time you go to the doctor, he's going to tell you, well, you need a little more, and you need a little more every time, because you're not doing anything to lower your sugar. You're not doing anything to get the sugar out of your blood. Okay, so what insulin does is that it causes paralysis of the arteries and arterioles. All right, so that's your blood vessels, okay? They're stretchy, they're pliable, that's all good. But when they start thickening or when they don't get rigid, then that causes high blood pressure. And consequently, that's going to cause a stroke, it's going to cause a heart attack. So what happens is those vessels that should be nice and rubbery and elastic, they lose their ability to dilate and constrict. And that's what causes the high blood pressure. So I've told you just now, in a nutshell, the way you lower your blood pressure is to get rid of metabolic syndrome. And metabolic syndrome is high blood pressure, it's decreased HDL, increased triglycerides, and a BMI over 25. So just lose some weight, get the carbs out of your body. So here's what I'm going to tell you. Here's how you do it. you eat whole foods, you eat non-processed foods, you do ketosis, you do intermittent fasting, refined foods. So let me just say this. If it doesn't have a label, it's probably healthy, because it's the labels with all of the toxins in it. You flip over anything and read it. There's just so many ingredients, and it's what the food industry has done to food, and it's not food at all. I call it poison. It's just not something I want to put in my body, because I want my body to perform. Just like my car, I'd never put dollar gas in my car, because I know it wouldn't run. It would sputter and put. And then, I would know, I'm like, oh, it was that gas. But we do that to our bodies, and we expect it to perform, and it's just not going to. You've got to put good fuel in your body. Ask people that are in their 60s and 70s that have eaten too much sugar and too much carbs and too much bread and too much pasta. When they get to that age, they're like, well, even I interviewed some 30-year-olds this week, and they're tired all the time. And the reason is the carbs. It's what they're doing to themselves. And many of them are on blood pressure medicine. So I've given it to you in a nutshell, how to lower your blood pressure or prevent high blood pressure. And it's going to be to reverse it. You're going to reverse your metabolic syndrome. And metabolic syndrome, it really is, you got to stop the pulsing up, the secretion of insulin, and insulin is secreted when you're putting carbs in your body, okay? Well, really, it's increased with anything, but it's really jacked up if you're going to be putting carbs in your body. So all the more reason to pass by those fast food places, eliminate your breads, eliminate your complex, the carbs that are just spiking up your insulin. Okay, so congratulations to the winners. All right, keep sharing my videos, because people are literally dying to hear this information. So I appreciate you joining me. I'm not going to be here probably tomorrow night. I got my granddaughters here this weekend, so we're going to be having some fun, doing some fun things. But please, like I said, please share the video. And if you're ready to join the challenge, I am offering a few more spots. I've got just a few spots left. We start on March the 7th, and it's a 90-day challenge. In this challenge, the very first thing you're going to do is reverse your metabolic syndrome. That's what we do. We learn how to fuel our body properly. We learn what the right foods are to eat, when to eat it, and how to eat it. And I forgot to say this. The other thing that helps you to decrease your metabolic syndrome is fasting. Intermittent fasting and ketosis together, but it's got to be healthy keto. It can't just be any keto, and it really can't even be but a certain kind of fasting, because there are some fastings that don't really work to lower your blood pressure. So thank you for joining me. Hit the love button before you leave. Make a comment if you like, I want to get my blood pressure down. Yeah, and tell me where you're watching from. I've got some new people on here. I haven't seen you. So I appreciate you joining me, and I appreciate you share this video. Thank you very much. I'm going to let you hit the love button before I jump off of here. Oh, I saw Holly on here. It's weird. I can't see all the people that are on here. But, yeah. Okay. There we go. Barbara, hey. Gloria, good to see you. Holly, let's see. Lisa, hey, Holly, good to see you. Sarah Lynn, Tracy, all my faithfuls. Karen, June, thank you for joining me. Y'all have a great night.